So we were discussing infantile spasm. Infantile spasm, they are also known as West syndrome. It is a type of childhood epilepsy that is common in male infants in their first 4 to 8 months of life. And the features include characteristic salam attacks, just like a salam, that is flexion of the head, trunk, and arms, followed by the extension of the arms. And this lasts for 1 to 2 seconds, and this may be repeated up to 50 times. And how to confirm the diagnosis? The diagnosis will be confirmed on EEG. EEG will show hypsarrhythmia in two-thirds of infants, and a CT scan will show a diffuse or localized brain disease, for example, tuberous sclerosis. Tuberous sclerosis is basically a genetic disease in which there is benign tumor formation in the brain. So it is sometimes associated in 70% of the cases. It is associated with infantile spasm, which can be confirmed on CT scan of the head. So infantile spasm are confirmed on EEG and CT scan. The prognosis of infantile spasm is very poor. Let me show you an EEG of infantile spasm. So you can see these normal wave and followed by these arrhythmias, which is known as hypsarrhythmia on EEG. And this is the diagram of infantile spasm, that is flexion of the head, trunk, and arms, followed by extension of the arms. And the second name for infantile spasm is West syndrome. The diagnosis is confirmed on EEG and on CT scan. The prognosis of this condition is very poor. Vigabatrin is the first line therapy for infantile spasm, and ACTH is sometimes also used because it is hypothesized that infantile spasm may be caused by corticotropin releasing hormone excess. So that's why ACTH is sometimes also used to treat infantile spasm, because ACTH will suppress CRH level, and when CRH levels are suppressed, the symptoms can improve in infantile spasm. So the first line treatment is Vigabatrin, and the second line is ACTH. Next treatment is, next topic is febrile seizures.
So what is the meaning of this salam AH? What does that mean? Is that a mnemonic?
Salam means, no, that is like Muslims do salam, in which they flex.
Yeah.
That's why they are called salam attacks.
Okay. So the position of the child becomes like
Yes.
In that.
Yes, flexion of the head, trunk, and flexion of the arm.
Okay.
The typical way of Muslims, mainly Indian Muslims, they do salam like this.
Okay. Thank you.
So our next topic is febrile. What are febrile seizures? Convulsions that are occurring in children from 6 months to 6 years of age without any underlying cause of seizure, such as CNS infection or meningitis and electrolyte disturbances. So convulsion or seizure in children from 6 months to 6 years of age without any underlying cause, such as CNS infection or electrolyte disturbances. So before labeling a child as a case of febrile seizure, you need to rule out CNS infection and electrolyte disturbances. If these two tests are normal, then you will label the patient as febrile seizure patient. Febrile seizures are classified into simple, complex, and febrile status epilepticus. Simple febrile seizures are if the seizure is less than 15 minutes duration, or if the seizures are generalized and tonic-clonic, then they will be labeled as simple febrile seizures. And if the seizures are more than 15 minutes of duration and they are focal, then we will label them complex febrile seizures. And if the seizure continue for more than 30 minutes without complete recovery, then we will label it as febrile status epilepticus. How high temperature can cause seizures? High temperature can cause seizures because in neurons, there are temperature sensitive channels. So when the temperature is increased, neurotransmission or neuronal activity is also increased, which lead to the development of these seizures, which are known as febrile seizures. Patient with febrile seizures, first of all, we need to put the patient in a recovery position and check airway, breathing, and circulation. And if the duration of the seizure is less than 5 minutes, then we only need to give antipyretics such as paracetamol. And if the seizure episode is more than 5 minutes, then we will give rectal diazepam. And we need to rule out other causes of seizures such as meningitis, hypoglycemia, and electrolyte imbalance such as hyponatremia. So after ruling out these causes, we can manage the patient. That is, if the seizure duration is less than 5 minutes, then we only need to give antipyretics. And if the seizure duration is more than 5 minutes, then we'll give rectal diazepam. And in the question, they will often mention that parents are worried if their child will get this type of seizure again, or will my child develop epilepsy in the future? So these are the common questions which parents often ask. So both are very easy to answer. Remember that 1/3 of the patient who experience a febrile seizure, chances will there are chances that they will experience another before the age of 6 years, and 1/3 of these patients will go on to develop epilepsy. So roughly 10% of complex febrile seizure patient develop epilepsy. So you can answer these two questions by this way. Now, what are the causes of seizure without fever? The first and the most important cause is hypoglycemia. So always start with obtaining pulmonary glucose level. Hypoglycemia is the most common cause of seizure in hypoglycemia. Now, another type of uh, a seizure that is common in children is breath holding spells. That is blue breath holding spells and reflex anoxic seizures. They are common in a toddler, mainly 6 months to 2 years of age. And the pathogenesis of both of them is same, and the management is also same. So minor injury, pain or fear plus minor crying can lead to unconsciousness for 1 to 2 minutes and then rapid recovery. So due to minor injury or pain or fear, the child become unconscious due to a decreased oxygen supply to the brain. They can be blue breath holding spells. That is, the child turns blue and stops breathing. So due to pain, the child excessively cry and he turns blue and then stops breathing. This is known as blue breath holding spells. And reflex anoxic seizure is that due to pain, there is a sudden reflex activation of the vagus nerve, which will lead to asystole. That is, his heart stop beating just for a few seconds. And due to stopping of his heartbeat, the child becomes yellow or pale because there is no blood flow to the skin or to the body parts. So that's why it is known as reflex anoxic seizures. So in the breath holding spells, the child turns blue, excessively cry, turn blue and stops breathing. And in reflex anoxic seizure, the child just suddenly stop his heartbeat and turn pale. That's why it is also known as white breath holding spells. But in the Plab 1 exam, you will not usually be asked to differentiate between these two. So this is just for your knowledge, how to differentiate between them or why they are called white breath holding spells and blue breath holding spells. The management in both the cases is same, that is reassurance, because they are self-limiting conditions and child usually improve on his own. So the only advice you will give to the parents is to place the child in recovery position until the episode ends and check ferritin and iron deficiency anemia if present, because the main problem is due to decrease of oxygen. So that's why we need to check ferritin levels and treat iron deficiency anemia if it's present. So now another CNS condition, that is dysgraphia, a learning disability that affects writing abilities. Dysgraphia is basically a learning disability that affects the writing abilities of the patient. This question was asked previously in the Lab 1 exam. So it was asked that a child with learning disabilities, uh, what is the most appropriate step in the management? We need to refer such kind of patient to educational psychologists, because educational psychologists will help create a therapy plan for children to improve their coordination and handwriting skills. They consult with multidisciplinary teams to advise on best approach to help the child's development. Now, another non-harmful condition, that is plagiocephaly and brachiocephaly. Plagiocephaly is that flattening of the head on one side. So one side of the head is flattened and it looks like an asymmetrical head. When it is seen from the above, the plagiocephaly, a parallelogram is seen, while brachiocephaly is flattening of the back of the head. When the back of the head becomes flattened, it is known as brachiocephaly, and when one side of the head of the back of the head is flattened, it is known as plagiocephaly. These problems are quite common. They affect around 1 in every 5 babies at some point. Most of the cases, they are not major causes of concern because they does not have any effect on brain development, and the head shape usually improve by itself over time. And baby usually won't experience any pain or other symptoms. So only reassurance is required in both the cases if the parents are concerned about the shape of the head of their baby. Will the child's head shape return to normal? If the flattening is mild, then it will usually improve with time. And if the flattening is moderate, then uh, heads may not return to a completely uh, perfect shape. So the only answer in the management of brachiocephaly and plagiocephaly is reassure the parents that he or she does not need to worry about this abnormal shape of the head.